Hi, everybody. This is Kelly Aiken from the National Fund for Workforce Solutions. I'd like to welcome you all to our webinar today, Introduction to Workplace Financial Wellness. We are thrilled to be wrapping up the third part in our financial wellness webinar series and are pleased to be working with Washington University of St. Louis on this series. Today's webinar is targeted specifically to businesses and employers who are interested in workplace financial wellness, specifically for low and moderate income workers. We are going to be together for the next hour. I encourage all of you to submit any questions you have throughout the webinar via the chat function. I will be monitoring that and asking questions of our guest, Ellen Frank Miller, today throughout the series. I'd also encourage all of you to keep yourselves on mute, as we have this webinar, sometimes background noise can get in the way. So with that, I am going to ask my colleague Michaela Romero to advance the slides. So today, what do we have on tap for our agenda? We're going to just do a quick introductions and an overview, and then get into the meat of the topic to talk about what is financial wellness, and then to spend the majority of our time talking about how to design and implement a financial wellness strategy in the workplace for low and moderate income workers. We have plenty of examples and resources to share with you, and we'll conclude with opportunities for you all to learn more. I want to recognize that we have a lot of different types of people in the audience. While this webinar is targeted towards employers, we also know that we have our National Fund site directors, we have community-based organizations and workforce intermediaries who are working directly with employers on this, as well as some providers of financial wellness services themselves. So thank you everybody for being on today's call. Before we jump into financial wellness, I did just want to tell you a little bit about the National Fund for Workforce Solutions. Michaela, thank you. So our mission is to really drive practices, policies, and investments that enable workers to succeed in good jobs, provide employers with a skilled workforce, and build more prosperous communities. You can see we are scattered across the United States, and we have 33 regional collaboratives with 85 active industry partnerships operating in 25 states. Our network is comprised of not only within our regional collaboratives, we have philanthropic partners, we have, as I mentioned, business leaders, we have workforce and intermediaries, education and training providers, all whom are working together to ensure that on the ground in your local communities, folks have access to good jobs, employers have that skilled workforce, and collectively you're building prosperous communities. So we welcome you to the National Fund if this is the first time that you are joining us. So why financial wellness? Michaela, if you could go to the next slide. So we do a lot of work to make jobs better. And financial wellness, we feel, is a critical component of what makes a good job for most of us. And so the goals of our financial wellness initiative is really to activate employers to invest in workplace financial wellness programs. We want to build the capacity of our regional collaboratives to actually work directly with employers to help select the appropriate solutions for frontline workers. Ultimately, we want to equip workers for success in the workplace, although with financial wellness, we recognize that this has a ripple effect. It really enables workers to be successful in the totality of their lives. And we know that by increasing financial stability and wellness, ultimately we're making jobs better for competitive advantage. We came to this work with the support of Prudential, and really we took a three-phased approach to our financial wellness initiative. Frankly, when Prudential approached us, we had not done a lot of work in financial wellness. So the first phase of our work was really to do a scan of the landscape. And from that scan, we issued a working paper. You can see it here on the screen, The Importance of Financial Wellness to Workers and Employers. And you can access that through the link here. I know that Michaela has sent out this PowerPoint in advance, so you all will have access to that. And that through this scan, we learned a whole lot. And we learned that we were never going to be experts and that we really needed to rely on those subject matter experts who are thinking about financial wellness day in, day out. And that really brought us to our next phase and an opportunity to partner with Washington University of St. Louis because they are on the leading edge of evaluation and assessment of what frontline workers need to be financially well and healthy, but also the efficacy of different products and services. And for those of you who have looked out into the marketplace, there are lots and lots of products and services. And that brings us then to our third phase, where we are working directly with Washington U to bring resources to our collaboratives, to employers, to help make good decisions about what products and services will work best for your frontline workers. So that has been our journey to date. We'll conclude this webinar by telling you a few more things. But now I'd like to introduce our partner at Washington University. Ellen Frank Miller is really the person who spends every day, all day, I think, thinking about financial wellness. Michaela, if you could go to the next slide, please. Thank you. And so at this point, I'm going to turn it over to Ellen and let her walk through the content of this webinar. Ellen, thank you for being with us today.
Terrific. Thank you so much for having me. I'm Ellen Frank Miller. I'm a researcher at Washington University in St. Louis. And Michaela, if we could go to the next slide, we wanted to just first thank our very generous funders without whom this work could never have been done, the Kellogg Foundation and JP Morgan Chase. If you move to the next slide, so just to briefly introduce myself, I'm senior scientist at WashU, and the research that I do really centers around this sort of central question about how employers can improve the financial stability of their frontline workers, so of their more low and moderate income workers. And the way that we conduct our research spans a wide range of factors that can improve financial stability, and employee financial wellness programs are one of them, which we've been doing a lot of research on the last couple of years, and look forward to sharing more. Prior to becoming an academic or pracademic, we call ourselves practical academic researchers. I was in human resource consulting for about 15 years with Hewitt Associates, and also worked Family Directions and Ceridian. And during that time, as well as in our research here at WashU, I've had the opportunity to work with employers in a wide range of industries and fields, which has been just a wonderful opportunity to understand the range of sort of challenges and opportunities that employers face, and the ways in which workforce opportunities are different and as well as similar. So you can see some of the fields that I've worked in the past. Next slide, please. So to set the stage a little bit, as most of us are aware, although we have a good economy, there are still many, many workers who have financial struggles. And some of these statistics here may sound familiar to you. Research by the Federal Reserve Bank recently showed that almost half of adults surveyed were not able to cover a $400 emergency expense without either taking on debt or selling something, which is a pretty dramatic statement about a very large portion of folks who were surveyed. Our own research with my colleague Matt Despard, who is also on the call and may chime in, showed that issues of what we call financial shocks, which, we do have folks who day to day, paycheck to paycheck, may make the ends meet. But when something occurs like a car accident, a repair that comes up, for example, an unexpected healthcare expense, that this can really throw families and workers into very difficult situations. And a survey recently of full-time workers said that almost half spend 3 or more hours during their work week thinking about or dealing with financial issues. So although the research about the actual connection between financial stress and work performance is still developing, it certainly, from an intuitive perspective, makes sense that when folks are dealing with stressful situations and with financial challenges, that they're not able to bring their best selves to their jobs. So that sort of sets the stage for why we are interested in this topic. We go to the next slide. This is a model of financial health that was developed by the Center for Financial Services Innovation that we find to be a really helpful frame for thinking about sort of what is the ultimate goal, the eye on the prize. What does financial wellness look like? And they've categorized this in ways that we think helps us to conceptualize what are the activities related to your financial well-being that people need to be in a position to master? So spending, saving, borrowing, and planning. So with regard to spending, you're financially healthy when you spend less than you earn, and when you're able to pay your bills on time and in full. In terms of savings, you're financially healthy when you have sufficient living expenses in liquid savings for when financial shock or other kind of emergency arises, and that you have sufficient long-term savings or assets for your future. With regard to borrowing, you're financially healthy when you have a sustainable debt load. So most Americans have debt, but the question of whether the debt is a stressor or not has to do with the level of it and what you're able to manage with the resources you have. And additionally, having a prime credit score, which I think many people who come from more middle class or affluent backgrounds take credit scores a bit for granted. We come from different kinds of advantage, and we perhaps know a lot about how to use the financial system in an effective way and to our advantage. But if you don't have a prime credit score, not only is it very difficult to access credit when you need it, but credit is very expensive. So that is another element of financial health, is having a prime credit score. And then finally, you're financially healthy when you have appropriate insurance that can buffer you against those kinds of financial shocks we mentioned, and when you're able to plan ahead for expenses. So that's sort of the framework of where we ultimately hope that we can help workers to arrive when they achieve financial health. And the next slide, wanted to just give a quick lay of the land. This is an incomplete probably list because a day has gone by since we developed it. And as Kelly said, financial wellness products and services are mushrooming, and new ones are coming into being every day. So this is a sampling of some promising products and services that exist, some of which there's some good solid research about the effectiveness, and they have been around for a lot longer, others of which are really newly emerging and which the evidence base is developing, and this is why we're doing the work we do every day. So just a couple of examples here. Financial coaching and counseling is an offering that has been in existence in community-based organizations for quite a while, and is more recently been offered as a workplace benefit. Some of our research on the effects of financial coaching and counseling have demonstrated, as I was mentioning before, with regard to credit outcomes, that the folks who are in the most vulnerable credit situations, so those with the lowest credit scores, in our research study appear to benefit the most from the opportunity to have these kinds of services, that they are able to increase their scores the most compared to other workers. So that and financial education is another area where there's been quite a bit of research. Although with financial education, the findings seem to suggest that when financial education is offered on a just-in-time basis, so you get the information you need when you're going to take action on it, that it can have some good outcomes, but that financial education that's offered perhaps as a workplace seminar that sounds interesting, that perhaps I attend, that the longer term results with regard to behavior change and outcomes is not sustained. So there are a number of other kind of interesting ones here. Pay advances are a pretty interesting innovation that has come around. Perhaps some of you have seen articles about Walmart offering a pay advance app that's called Even. And what this enables employees to do with this app is to access accrued wages. So we know that sometimes financial challenges arise when bills are due, but paychecks are not coming for a little bit. And what this app enables workers to do is to access accrued wages in advance of payday, and then when they receive their paychecks, that amount is deducted. So that is intended to help deal with the potential timing challenge, and can give employees the opportunity to get sort of almost like a little bit of additional credit prior to their paychecks. Another interesting one to mention is small dollar payroll linked loans. So these are, although many employers we've discovered in our research have offered emergency funds of different kinds to their workers, which may incorporate grants on an emergency basis, but oftentimes also loans. The difference between the kinds of loans that we're talking about with financial wellness products are loans that the employer is not making directly to their workers, but rather they're working with a third-party service provider that is able to link up the payroll system of the employer and to make the loan to employees where they can make that repayment through payroll deductions. So a big advantage of this type of loan, of course, is that it's coming out of your paycheck. So having an excellent repayment history is very easy to do. And additionally, unlike a payday loan, for example, where first of all, interest rates are predatory and hundreds of percentage points. But additionally, you can pay off a payday loan with a perfect payment history, and it does nothing to improve your credit. In contrast, a payroll-linked small dollar loan is a credit-building loan. So employers are helping their workers in two ways, one of which is giving them access to the resources that they need, to credit resources when they need it, but also as a way to improve their financial health by improving credit scores over time. So I think if we could go to the next slide, there are probably some pretty exciting thoughts going on right now, and this is the moment where I tell everybody to please stop before we get too excited about any particular solution. Before we consider what financial wellness product or service might be most useful for our workforces, we really want to take steps to maximize our investment and to be sure that what we've selected has the best chance of being successful and will be good stewards of our resources for employees. So on the next slide, so this is kind of a model way to think about a process for creating a financial wellness strategy that's very specific to the particular employer and the particular workforce and workplace challenges that exist in any given company or organization. So many times when we think about financial wellness products and services, the first place people go is, well, so what do our employees need? We need to figure out what they need so we can choose the right thing. But what we would encourage you to do is to take a step back from that stage and to really think first about what are the realities of my employees' financial lives. And by understanding employees' financial lives first, it creates a context then for understanding articulated needs. So we'll talk in a minute about some ways that employers can, using existing data that they already have and also ways to go about collecting additional information, can gain an understanding of employees' financial lives, and then also can do some assessment of what the needs might be in order to select programs that would meet those needs. And then the last, well, let me back up. So those two steps of assessing needs and selecting programs, I have here a bracket about human-centered design, which is a technique that really makes a lot of sense and involves thinking about the folks who will actually use whatever it is you're going to implement and asking them directly to weigh in on what are the things not only that they think would help them, but ways in which they might use these products or services, and to get their perspective on what would be effective in order to, again, to help ensure the best chance of success for a program. And then the last step in our flow chart here, in addition to implement, is evaluate. And I know no one is surprised to hear a researcher tell you that you should evaluate your program. But the reason that we put that right up front as opposed to after program's been in place is that when you build in the idea and the thought of evaluation right up front at the time that you're thinking about adding or implementing something, it enables you to think about measurement think about what is practical and possible and meaningful right at the beginning, so that when you have a chance later on to assess how your program is going, you've already planned for how you'll do that. Additionally, it gives you the opportunity to be able to put checkpoints in as a program is unrolling and unfolding in the organization, in order to be sure that if you are seeing any issues, you're catching them early enough to make course corrections and to sort of interrogate what is going on here, what might need to be different to make our program more effective or more successful. So if we go to the next slide. So these are some ideas about how employers can use data, in this case that you already have, in order to identify what employees' financial lives really look like and to help assess what the needs may be. So whether large organization, small organization, human resource records, electronic records exist almost everywhere, and they're a great resource for understanding the issues that employees may face. So one real basic thing that is kept by every organization are wage and salary ranges. These obviously differ by people's levels in the organization, but those data are there. We put a link here to the MIT Living Wage Calculator, which is a nice resource that enables employers to think about the level of wages specific to the location they are geographically, because as we know, cost of living varies greatly. $15 an hour in one place is not necessarily the same in another. Another resource for organizations that are providing retirement plans is to work with the retirement plan record keeper administrator to look at things like what are the deferral rates among our employees. This is a proxy for people's ability to save, although we know that promotion of these programs and helping people understand how they work and the advantage certainly contributes to the deferral rates that you see. It can also be a flag, for example, of the possibility that people are having difficulty saving if those rates look low. Additionally, retirement plan records can show you if there are a substantial number of hardship withdrawals or loans being taken on those 401k or 403b balances, and this can be a proxy for financial distress. Ideally, people don't tap into those resources unless they've exhausted other opportunities. So those are some ideas of how organizations can use existing data. Another one is a benefits package audit. And in this regard, it's a matter of looking at what do you currently have, and how does that fit in with what you perhaps now learned about the financial status of your workforce. I was just speaking with a bank executive yesterday who was sort of struggling with turnover at the lowest level in the bank in their payments area, and was talking about how they last year had raised wages to $15 an hour, which in their community where they're mostly located is a good wage. And she said that they're full-time, they have access to our benefits package, and she began talking further about some of the issues with the type of work and the schedules that could be an issue. And I stopped her and said, it would be worthwhile to look at the details. When you say they're eligible for your benefits package, it's important to look at what that looks like. For example, if your health insurance plan is a high deductible plan, which many are today, look at what that deductible is. If you have a high deductible plan with or without a health savings account, that's $3,000 a year. Jump back up to the point above about wage and salary ranges. Do some quick math and look at what does it take for an employee in those entry-level jobs to cover $3,000 worth of medical expenses before their health insurance can help them out. And it's not necessarily that there are lots of ways to overhaul existing benefits, but it's part of what can help you make decisions about what types of supports might be most effective. So if we go to the next slide. So in addition to existing data, of course, there are opportunities to get more information. As we said before, specifically asking employees, what are the realities? What are their most pressing needs? What do they think would help the most? Many organizations do annual surveys of some sort, whether it's a benefits survey, an employee satisfaction survey. Some cultures are surveyed a lot, and that may be an opportunity to either add a few questions or maybe conduct a survey to get that kind of information from employees. Interviews and in some cases focus groups are other opportunities. But I always remind people, don't overlook your on-the-ground management. When employees have financial challenges, on-the-ground management and human resource professionals are the ones who hear about it first. Whether that's a manager who notices that a good performer is suddenly coming in late frequently, and maybe discovers that actually there's been a problem with a car and they can't afford to get it fixed and they're having trouble getting to work, or a human resource professional hears from an employee that there's perhaps been a death in the family and expenses for funerals are unmanageable. The folks who are closest to the front line have a lot of information to share, and finding out both what their perceptions of the challenges are and their perceptions of what can help is a really effective way to, again, get to that place where you have a sense of what employees' lives are like financially and also what their needs may be in order to move to the next stage, which would be on the next slide. So when we looked at the model of financial health and the spend, save, borrow plan, you can see here that then we've juxtaposed a list of some of those types of financial wellness programs on the left-hand side, and created this matrix of the ways in which each of these types of programs may be able to have an impact on employees' financial well-being. So some of those are a direct impact, that's the D's, and some are indirect. And also on the far left side, you'll notice that we have sort of a continuum here of what we call high and low touch programs and services. So high touch service, for example, coaching, counseling, or debt management, that involves some kind of one-on-one interaction between an employee and someone from the financial wellness service provider to assist them in their particular financial situation. These can be in person, sometimes telephonic, Skype, for example, and for the first line on this chart, the coaching and counseling, you'll see that the kind of assistance that is available to employees cuts across all 4 areas of financial health and well-being, and they're all indirect types of assistance. So financial counselor can help employees look at what their debt situation is and to help them come up with a strategy on how to manage their debt or reduce it, can help them also plan for saving strategies as well. When you look down, for example, towards the lower touch interventions like student loan repayment, which is second to the last, those have a direct effect on the sustainability of debt load. So some employers have begun offering employees some kind of assistance in paying off student loans. And in this way, they can have a direct effect on people's ability to have their, to pay their debt. It also has an indirect effect on people's credit scores, as well as on their ability to spend less than they earn and also to pay bills on time. So this might be an opportunity to just quickly stop and see if there might be any questions. There's a lot of information here.
So Ellen, one question, are all these products and services created equal, or are some better than others?
So the answer to that question, Kelly, as you know, is on previous slides, because what is most effective or least effective has everything to do with the specifics of the type of needs of a particular workforce. One thing that I'll say about, we know we have a lot more research knowledge and evidence base for the effectiveness of some types of programs and services than for others. And it's also important to think, I think about the, whether or not something is providing sort of a longer term opportunity for folks to develop their financial well-being. Like, for example, pay advances can be invaluable to employees who are dealing with that mismatch of when a bill is due and when a paycheck comes out. But ultimately, a pay advance is not going to close the gap for someone who in the spend column is unable to spend less than they earn, who's not able to make the ends meet. So I hope that answers that question. Were there other questions, or actually Matt, is there anything that you want to contribute? Matt is also a researcher at WashU and has done a lot of this work, particularly with regard to credit.
Sure, Ellen. Yeah, actually, I want to pick on pay advance. So I'm going to kind of pile on here. And the reason is, on the one hand, yeah, it is advantageous in that it provides low and moderate income workers an alternative to things like payday loans, where in states where they aren't banned, and other forms of high cost credit. But boy, if there is an example from this list of a Band-Aid, I think that one is it. And in particular, it can mask other problems in the workplace. So as an example, Ellen, you mentioned high deductible health plans and health savings accounts. If an employer has switched to that type of health insurance arrangement, and low and moderate income workers have cash flow challenges because they're having to pay up front for their medical bills until they reach their deductible, well, then along comes pay advance to slap on the Band-Aid. So again, I don't want to pick too much on pay advance. It's a good thing to have in contrast to things like payday loans. But to your point, Ellen, it really is woefully insufficient for helping to improve financial health, which is why we need to look at other tools like savings programs and financial coaching to help people do things like improve their credit health.
Thanks, Matt. Ellen, I'm just going to push us along to, given the time.
Okay, we can go to the next slide. So what I have now for you is some vignettes, which I'll go through kind of quickly, that are sort of amalgamations of employers that we've worked with in our research and how they went through the process of choosing their financial wellness products and services. There's a link at the bottom here for some more examples at a blog series that we recently completed with Prosperity Now that I think you may find helpful. If we can go to the next slide. So our first employer focused on low-cost savings. So this was a nonprofit childcare center with less than 100 employees, mostly women, many close to minimum wage workers, and they did not have a lot of resources to devote to implementing financial wellness products or services. If we can move to the next slide. So the approach that they took was, as a small employer, they had a real firsthand understanding of what the issues were that employees struggled with, and certainly wages were low, and they knew from popular press that a lack of savings was a generally large problem, and that they knew that their workers really struggled. So the savings felt like a manageable place to start, and there was also a community partner, a nonprofit, who was offering a savings promotion program, and there was no cost for the employer to participate in that. If we go to the next slide. So as you can see, savings programs there on the left-hand side has a direct effect on building liquid savings and also an ability to help build longer-term savings. So that's where that fits into the financial health model. If we move to the next slide. So the first thing they did was to look at their direct deposit form, which they were able to make some minor, very minor changes in order to encourage savings using behavioral science principles. So as we know, for example, if the first choice in an option is one that looks appealing, people are more likely to choose that than to go down to the bottom of the list. So if the first choice is split my deposit of my paycheck between checking and savings, that can encourage employees who are able to set aside money that way. They partnered with a local credit union, which where they were able to get some favorable terms for employees who didn't have accounts. And they also did a raffle to encourage folks to actually go ahead and set up direct deposit into savings. They took a look at changes over time, and that was how they were able to get a sense of whether the program was helping. So this is a really sort of a basic way to make a change that didn't cost the employer a lot of money, and focused on a very kind of key basic element of financial health. If we go to the next slide. So the second employer was a slightly larger organization, family-owned business, and most of their employees were earning above minimum wage, and they did have some resources, particularly staff time, to dedicate to looking at financial wellness products and services. And they chose to focus in on savings, credit, and financial coaching. So to the next slide here. So one thing that was interesting when we talked to the senior leaders of this organization is that it was not uncommon for them to be approached by their employees to get an advance on their paychecks. And in some cases, they were even asked if they could make a loan to the employee for a problem, healthcare or some kind of car repair. And so based on that, as well as their knowledge of the lack of savings in the US, they had the sense that there were some opportunities for a couple of different approaches, one of which was to work with the bank that they used as a business banking partner, and to see if they could provide that favorable terms to their employees. They also looked into payroll-linked loans as a way to give employees the opportunity to borrow without having to come to their employer and reveal their situation. And then additionally, there's a nonprofit in the community, as I mentioned, that was offering financial coaching, and they were able to partner with this organization to provide financial coaching to their employees. And in this particular case, their workers worked overnight in some cases, and many of them were non-native English speakers who were most comfortable communicating in Spanish. So they partnered with this financial coaching organization to offer, basically promote the service during the overnight shifts and have Spanish-speaking financial coaches available in order to support these employees. And this organization had a tradition of doing quarterly barbecues, and this provider came at 2 o'clock in the morning to the quarterly barbecue to promote the financial coaching service. So a good close relationship between the service provider and the employer was a real key to the success of that program at this company. If we go to the next slide. So again, here on the left-hand side, we have coaching and counseling, which crosses across the various areas of financial well-being and financial health. Loans and payroll-linked loans there have a direct effect, both on having access to credit and to building a credit score, and then access to accounts to enable savings at favorable terms has a direct effect on liquid savings and indirect on their longer term savings. So if we go to the next slide. So again, the steps that they took were to partner with an existing relationship that the business had, to research and identify a payroll-linked loan provider, which the loans are at no cost to the employer, and then to create this partnership for financial coaching with an existing nonprofit in the community. So thank you. So a third employer that we were working with was a very large manufacturing company with 3,000 US-based employees and others overseas. And their interest was focused on their factory floor workers. Some of these facilities are located in economically distressed communities, and they had heard from folks on the ground, their management on the ground, that there were financial challenges that workers were facing. And the organization as a whole was engaged in developing their new global wellness strategy, which had always been focused on physical and emotional health. And they felt that financial wellness was a really important missing piece that they wanted to address. And the organization had a moderate budget to consider financial wellness comprehensive strategy. So we move to the next slide. So that initial understanding from their HR partners that there had been financial issues and struggles was where they began. And they also had an emergency fund that they were able to take a look at the records of it to try to get an understanding of what some of the issues were that folks had been applying to the emergency fund for. They have a financial education program that was already in place, providing online resources, and they were able to collaborate with that provider as well as the record keeper for their 401k plan to look at what they could understand about existing patterns of people's interests in financial education, and also look at patterns of hardship withdrawals and loans, as well as deferral rates. On their HRIS system, in addition to looking at what they could learn about how wages were distributed, they also had data about safety and absenteeism. And safety is a really important corporate value in this organization, and they believed that there was a relationship between people feeling financial stress and safety records. So that was something they were really interested in examining. And then they partnered with university researchers to do a survey of employees at one of the facilities. Also we conducted interviews with human resource partners and also with frontline managers to try to get a sense of what the challenges were from the perspectives both of the employees as well as management. And then from there, we're able to develop a pilot plan to test out with that facility and address the kinds of issues that were identified. And then, as I mentioned before, measuring outcomes into the plan right up front has set the stage for being able to implement strategy organization-wide when the results are in. So if you go to the next slide, you'll see, stay tuned. So this one is in progress. So I guess if you go to the next one, now I'm kind of transitioning to talking about some of the resources that we have developed, Washington University and St. Louis has developed in partnership with Prosperity Now, that can help employers to take that step of really looking at how can I go ahead and move to the next stage of looking at financial wellness programs for my workforce. So these are 3 different how-to guides that are available. There's a link at the bottom here to looking at how to engage employees once you've determined you're going to go ahead and do a program, how to get buy-in internally, which is very important for program success, to have frontline managers and senior leaders on board with new initiatives, and then how to roll out a program successfully. So those are available on the website. If you go to the next page, we also have a more in-depth resource, a primer on workplace financial wellness services that's very comprehensive and available as a PDF, and really can help walk through the steps of what we just discussed and how employers can bring these things into, to life at their organizations. If you go to the next page, yeah, so these are the links to the ones I just mentioned, as well as to our blog series, all in one place. And I think so we now have an opportunity for questions. Kelly, how are we doing?
We're good. So thank you, Ellen, for that's a lot of information for folks. And I really encourage those who are interested in learning more to follow up and take a look at those resources. While we have a little bit of time here, I'd love to just pick your brain a little bit more, Ellen, since you're on the ground doing this work and talking with a lot of employers as well as employees and middle management. So as you are, you've given us 3 vignettes of what appear to be successful financial wellness programs or strategies for rolling these out. But why might a financial wellness program not work? And are there some cautionary tales that you can convey? Even if there seems to be clear employee need, sometimes the stars aren't aligned. So tell us a little bit more about how to navigate those waters.
Sure, thank you. So I think, and Matt, also please feel free to join me in talking about some of our research here. one of the most common things that I think we've run across is employers who recognize that there's a problem and have an idea. Excuse me a moment. Excuse me, and have some ideas about potential solutions, but haven't taken that step of actually going through to understand employees' financial lives and also to assess what the needs may be and what solutions may be most effective. So it's I think, kind of a classic case of hearing something that sounds great, hearing from others that it's been really successful in their organizations, and making the decision to implement a program without necessarily testing to see whether what's being offered is the right solution for what the challenges are. So when we see that mismatch, a really great program that could be effective in another environment may turn out not to be successful in that company. And it's always a shame because, of course, there's been a lot of time and effort put into it, and no one ever wants a program to be unsuccessful. But when I'm thinking of another employer where they started with a particular program, and because they built measurement and evaluation into their plans up front, they were able to kind of catch that early on and to address the mismatch and work with the vendor to kind of tailor the content of their program more directly towards the needs. Matt, I wanted to see if you have another story you could share.
Yeah, I think just in general, the reason why a financial wellness program might not work would be if the pay offered by an employer is just too low, the benefits are too weak, or the scheduling, the work scheduling is too unpredictable for a service like financial coaching in the workplace to really make much of a difference.
Thanks, Matt. And Ellen, appreciate that. And, you know, I think the other thing that we hear a lot about is just the plethora of digital platforms and apps that are really coming to market every day. Can you just talk a little bit about the excitement around some of those digital platforms and apps and what people should be looking out for when they're considering, you know, the efficacy of some of those programs?
Sure, absolutely. So I think one of the exciting and big advantages of digital apps is that they do enable employees in many cases to connect their accounts to the apps, which gives people an ability to kind of keep an eye on their spendings, to set savings goals, and it's all in one easy place on a phone or a computer where people can really kind of keep their finger on the pulse and be able to manage their finances and build towards a goal. I think some of these apps, they have like push notifications where you can have that nudge of a reminder about making a payment towards your debt or an extra contribution to a savings account. And there are definitely ways in which digital platforms are doing a range of things beyond budgeting, like, for example, enabling employees to use pre-tax spending accounts without having to submit physical paperwork, and instead they monitor the transactions that are in the linked accounts, and they can identify something and say, for example, you have contributions being made to a pre-tax healthcare spending account. You have a transaction here at a dentist's office. If this is true, they will ask you to confirm, and if it is the case, then it's submitted for you automatically to the employer as a reimbursement for tax-free, tax advantage savings. Matt, I know you're itching to talk about some of the downsides that we just discussed. Do you want to jump in here?
Yeah, sure. So I think one obvious one, given what Ellen just mentioned, that these digital platforms, one key technological advantage is that they can link to workers' transaction accounts. It's obviously not a good solution for unbanked workers or workers that don't own smartphones or other devices that would enable them to use these platforms or apps. And I think just in general, these platforms and apps they're awfully tempting as a potentially low cost and highly scalable solution, but it's important to look carefully at, well, what exactly does this, with all its bells and whistles, what exactly does this platform or app do to help improve financial outcomes? And what is the quality of the evidence that the provider may have concerning the types of outcomes employees have achieved using their technology?
And I'll just add one quick thing, Kelly. This is where the employment context comes into play and is so important. Most workplaces don't want their employees on their phones all the time. However, there are some work environments where folks really don't even have access, to technology during the day. Home health care is a good example where someone is, responsible for a vulnerable person who needs hands-on health assistance. So while having some kind of technology can be useful, there's limitations to when people can access those. Same thing with for example, online financial education classes. If you don't sit at a computer all day, it's very difficult to make time for that perhaps in the evening, whereas an employee who is in an office setting, that can be perhaps a more useful resource if they can sit at a computer during their lunch hour.
Great. Yeah, really good points about just understanding how accessible all of these different products and services are to your workforce. I'm struck by and I don't think we have this actually in the presentation, but your work with Prosperity Now, that there has been an effort to catalog or at least provide a directory of different types of products and services. Can you just talk a little bit more about, I believe that there's a database that is available, and we can certainly send this information out in the follow-up to folks.
Yes, definitely. So when we first began this work and partnered with Prosperity Now, we created sort of as comprehensive a list as possible of different kinds of financial wellness programs and service providers. We're not recommending or in any way endorsing them, but to give a sense of the range of programs that are out there. We had direct contact with all of these organizations just to be sure we had the facts straight. And it's a resource for employers who are sort of trying to get started with understanding the lay of the land of both what types of services are offered and also who some of the providers and players are on that website. So I think it's a great resource as a place to start when you are considering a particular type of program. After, of course, you've done the assessment up front.
Great. So thank you. I'll just put a call out for any other questions that folks might have. Again, I want to thank Ellen and also Matt, who was able to jump on last minute for taking the time, and to reinforce that we will send out the link to the kind of the directory of products and services. But we are, and WashU is, as you mentioned, not endorsing any particular product, but really talking about the process by which employers can select products. So thank you, Ellen. And now I'd like to turn and just tell folks who are interested about potential opportunities to learn more, specifically with WashU and with the National Fund. So for those of you who are affiliated with the National Fund, whether you are part of the site itself or you are an employer who is perhaps engaged in an industry partnership or working directly with our National Fund sites, we wanted to make sure people are aware of our Workforce Solutions Innovation Fund. This is a new opportunity for our sites. We are, through the Innovation Fund, we are enabling our sites to access Washington University of St. Louis's technical expertise, and they are available to all of our sites. We are actually offering small micro grants, $10,000 to 6 of our collaboratives to support you on the ground in innovative strategies to increase awareness and adoption of workplace financial wellness strategies. And as part of that, WashU can actually come to your city, to your town, to provide some technical assistance. And there is, we have within our relationship with WashU the ability to pay for that visit, for one visit. And then if you're interested in additional technical assistance, you can include that in the scope of work as part of your submission for the grant. Funding timeframe is that we are looking to engage with sites over the next year. Actually, Friday is our first round of concept papers. This is not intended to be a heavy lift for folks, but this will be on a rolling basis, so first come, first serve. And if you have more, if you would like more information, please feel free to contact me. Those of you who are at National Fund sites, you are aware that all the information is on our website, on our collaborative site page, which is just made available to you. So please consider how you can engage with WashU and figure out how to bring more information and strategies directly into your community. So, and we thank again WashU for working with us on this. And then another opportunity is actually to join us in Dallas in June at our biennial meeting. The time is now, Building an Economy that Works for Everyone. So this is our convening that will bring together over 400 workforce development professionals, employers, frontline workers, and funders, training and education providers, to really focus on the immediate issues at hand. And specifically, Ellen is going to be with one of her partners from Lutheran Social Services of Minnesota, Christine Fell, and they are going to be talking about how they've worked together in a workshop on June 26th, and how financial wellness, workplace financial wellness has helped, and the strategies specifically used at Lutheran Social Services. So if you are interested, please feel free to click on the events page. Registration is filling up, and we look forward to seeing many of you in Dallas, and there will be an opportunity, as I mentioned, to meet Ellen in person. So with that, I don't see any other questions. So again, Ellen and Matt, I want to thank everybody for joining us today. This webinar has been recorded and will be included in the follow-up email, as well as being located on the National Fund website. With that, I thank everybody and hope you all have a great afternoon. Thank you.